हेलो स्टूडेंट्स, आज हम स्टार्ट करेंगे FMT PYQ एम्स 2020 में एंड नवंबर INICET। The first question है identify the type of skull fracture in the given image. A ring, B depressed, C fissured, D comminuted। इसका आंसर है D comminuted। The correct answer explanation के साथ। The given image shows as a comminuted fracture of skull। Second question है a middle-aged man was brought to the ER after an assault with a sharp axe. Identify the type of wound. A. Incised wound, B. Chop wound, C. Lacerated wound, D. Abrasion। इसका आंसर है chop wound। The given wound caused by an axe is likely to be a chopped wound। Chopped wounds are so called because of the action in which they are produced. Depending on the type of instrument, they may resemble an incised or a lacerated wound. The shape of the wound may give clues to the type of weapon. It would be a deep, well-margined wound, gaping with limited damage to the surrounding skin. For example, in the given image, the wound resembles an injury produced by a sharp axe. Such wounds may be inflicted with homicidal intent on the skull or scalp. Question number 3. A patient comes to the casualty with life-threatening injuries. There was no time for talking, consent. The doctor started doing life-saving procedures with all precautions and despite best effort. The death of the patient occurred. The doctor is not responsible under which doctrine? A. Res ipsa loquitur, B. Doctrine of anticipation, C. Doctrine of extended consent, D. Doctrine of conjugated consent। इसका आंसर है B. Doctrine of anticipation। Under IPC 92, the doctor can perform life-saving procedures in a patient with life-threatening injuries without obtaining consent. The guiding principle is whether the delay in treatment in order to obtain consent would result in harm to the patient. This is the doctrine of anticipation. Under some circumstances like emergencies, informed consent may be neither possible nor necessary. IPC 92 states that nothing is an offense by reason of any harm which it may cause to a person for whose benefit it is done in good faith, even without that person's consent, if the circumstances are such that it is impossible for that person to signify consent, or if that person is incapable of giving consent and has no guardian or other person in lawful charge of him from whom it is possible to obtain consent in time for the thing to be done with benefit. Question number 4. Which of the following is false regarding the management of snakebite in India? A. Atropine and neostigmine are very useful in the management of crate bite. B. Neostigmine and ventilatory support are used in treatment along with ASV. C. ASV is the mainstay of treatment. D. Current ASV in India is not effective against humped pit viper। इसका आंसर है A. Atropine and neostigmine are very useful in the management of crate bite. Atropine is not useful in the management of crate bite. The toxin in common crate venom acts presynaptically, hence atropine is not used in the treatment of envenomation by crate. As the cobra venom acts as postsynaptically, atropine can be used in the management. Anti-snake venom is the mainstay of snake bite treatment. Question number 5. A 14-year-old girl comes to the OPD with her mother. History of penovaginal penetration by the neighbor is reported to the doctor. The girl admits to giving the neighbor the consent for the same and says she doesn't want to be examined. As a medical officer, which of the following should you do? A. Should call the police. Second, should counsel mother and daughter. 3. Should do examination even after refusal. 4. Document refusal। इसका आंसर है B. 1, 2 and 4 are true। 1, 2 and 4 are true। Minor less than 18 years cannot legally consent to sexual act in India under POCSO Act. Medical practitioners or mandatory reporters must inform police regardless of consent or refusal. Counseling both the patient and guardian is essential for psychosocial support and informed decision making. If the patient refuses medical examination, the refusal should be carefully documented for medical legal purpose. Question number 6. A surgeon performed a hysterectomy for uterine fibroids after obtaining relevant informed consent from the patient. Despite adequate precaution, the ureter was injured intraoperatively. Under which of the following principle will the doctor not be held responsible for this act? A. Novus actus intervenens. B. Medical maloccurrence. C. Res ipsa liquidator. D. Physician error. इसका आंसर है B. Medical maloccurrence. The doctor will not be responsible for the above act under medical maloccurrence. Medical maloccurrence or inevitable accident. Every human being responds differently to different drugs as well as to different treatment modalities. On certain occasions, despite all proper care given by the doctor during treatment, the patient fails to respond properly or may suffer some adverse reaction to the drug which may lead to severe injuries or permanent deformities. This is known as a medical maloccurrence or inevitable accident. If the doctor can prove this before the court, it will be an absolute defense against malpractice. Question number 7. The punishment for the death of a patient by spurious drug. A. 5 years. B. 7 years. C. Life imprisonment. D. 1 year. इसका आंसर है C. Life imprisonment. The punishment for the death of a patient by a spurious drug is imprisonment for life. In case of an adulterated, spurious, or any drug that when used by any person for or in the diagnosis, treatment, mitigation or prevention of any disease or disorder is likely to cause ill health or is likely to cause such harm on his body as would amount to grievous hurt within the meaning of section 320 of IPC shall be punishable with imprisonment for a term that shall not be less than 3 years but that may extend to a term of life. Question number 8. Identify the seed shown in the image below. A. Tropicana canna. B. Nigella sativa. C. Datura seeds. D. Opium. Answer B. Nigella sativa. The seeds shown in the given image are of the plant Nigella sativa. These are also known as black cumin or kalonji. The seeds are most commonly used part of the plant in traditional medicine. Seeds have a pungent and bitter taste with a considerable amount of oil inside. The seeds are used as a spice in cooking. They are also used as a food preservative and the most often used therapeutic agent is its oil. Question number 9. A 12-year-old boy presents with the following injury that he sustained on being tackled by an opponent during the course of a football match. As the casualty medical officer, you would enter the wound description in the case sheet as A. Incised wound, B. Abrasion, C. Laceration, D. Bruise. इसका आंसर है C. Laceration. The given image shows a laceration. A laceration is a tear or a split in the skin, mucous membrane, muscle, or any integral organ with a depth spanning more than the covering epithelium of the skin or an organ and is produced by blunt force. Question number 10. You are posted as an intern in casualty when an MLC case is brought by the police with the following appearance. She was declared brought dead. What would you mark as the likely cause of death before sending the patient for postmortem? A. Drowning. B. Hanging. C. Strangulation. D. Traumatic asphyxia. इसका आंसर है A. Drowning. The given image shows frothing from nostrils and no clear sign of facial or conjunctival congestion. It is likely a case of drowning. Frothing may also be seen in throttling or strangulation, but it might be associated with the sign of conjunctival congestion, facial congestion, pattern bruise on neck, etc. In the absence of these fractures, it is unlikely to be caused by strangulations. Traumatic asphyxia is unlikely as the face of this patient is all whitened without sign of congestion or any obvious sign of trauma. Question number 11. What is the approximate age of a person in whom the medial end of the clavicle is fused and also the sternum is completely fused? A 18 years, B 18 to 20 years, C 20 to 25 years, D above 20 years. Answer is D 25 years. Approximately age for the given person with fused medial end of clavicle and completely fused sternum is most likely 25 years. The sternum is formed from the fusion of manubrium for sternibri and the xiphoid process. The fusion of sternibri occurs from below upwards, following by its fusion to the xiphoid process, and then fusion of manubrium to the fused sternum. Question number 12. Identify the condition shown in the image. A. Postmortem lividity. B. Marbling. C. Filigree burns. D. Subcutaneous emphysema. इसका आंसर है B. Marbling. The image shows postmortem marbling. It is a visible postmortem change that is characterized by linear branching patterns on skin that correspond to the course of superficial veins. Intestinal bacteria infest the venous system as blood acts as a nutrient medium for their proliferation. There is subsequent hemolysis which stains the vessel walls and the adjacent tissue, giving rise to marbling. This becomes prominent in about 36 to 48 hours after death in the summer and is distinctly appreciable in the superficial vein of the abdomen, shoulder, chest, and inguinal region. Question number 13. Identify the image shown below. A. Shotgun wound. B. Tattooing. C. Arsenic poisoning. D. Grazed wound. इसका आंसर है A. Shotgun wound. The given image shows entry wound of a shotgun from a mid-range or long distance. There is a central round hole with multiple pellet holes scattered around the central hole. This wound is most likely to have been caused by a shotgun from a range of 1 to 5 meters. Question number 14. A 22-year-old woman was found dead at home. She was brought to the mortuary by the police and the following findings were noted on examination. Which of the following is the likely cause of her death? A. Strangulation by ligature. B. Hanging. C. Throttling. D. Drowning. इसका आंसर है C. Throttling. In the given case scenario and autopsy images showing carotid intimal tear and muscles hematoma with nail marks on neck and absence of ligature mark point towards a diagnosis of throttling. Other options: option A, strangulation by ligature mark with sign of a struggle wound would have made this diagnosis more likely. Option B, hanging, ligature mark with a suicide note would have made it more likely. Option C, drowning body recovered from a pond or other water body with other suggestive features like frothing, etc., would have made this more likely. Thank you so much.